Michelle Schoenfeld, happens to be my wife, and she's concerned with the appearance of her hands. And as you can see, she has some two kinds of aging issues going on with her hands. One is that she has some sunspots, and the other one is that she has some loss of volume of her hands. And I think she's concerned with, and you are, I presume, concerned with the prominence of the vessels and some of the tendon issues that you can see. And she'd like to get rid of some of that. So we're going to use a product called Radius to inject the hands and fill them up a little bit so that they appear less prominent. So here we get started. So we've used a little ice as a topical numbing agent for Michelle, and I found that that works better than almost anything does for numbing up the area prior to any injections. And then we're going to wipe her hand off with a little alcohol so that that gets it. So what we're going to do is we're going to try to fill the areas between the tendons and around the vessels. And the way we're going to do that is we're going to pinch the skin and elevate the skin a little bit, and we're going to deposit a little bit of the product, which has already been mixed with a local anesthesia in there, lidocaine 2%. And we're just going to put a bolus in. We're not going to spread it out, and it's just going to be in the subcutaneous tissue. So you can see us filling that area up, and you can kind of see the bolus in there. I'm going to just do a little bit right now. Now I'm going to have Michelle make a fist for me. That around, and we're going to massage it in. That didn't hurt too bad, did it?
No, not at all.
There you go.
It really didn't hurt.
You got to really kind of massage it in. You don't want any lumps, obviously. And there. And we're going to put another little bit in. You can spread your hand out a little bit. Into this area here. So we're going to tent the skin again. Deposit a little bolus.
I got it.
Make a fist again, Michelle. And people like immediate results with very little downtime. And this is one of those procedures that actually does give us that. So put your hand out now. And I'm going to put a tiny bit more here. And again, there's prominent vessels, so you want to tent the skin up away from the vessels and inject in the subcutaneous tissue in just a little bit. Make a fist, please. Okay, and that's about 0.6 cc's. So why don't you compare that to your other hand? Smooth, huh? Nice and tight on that ring finger. There you go. Good. Excellent. All right. And that looks really pretty. Move your hand out. One more time. So we've injected a total of 1.3 cc's of Radius into the hands, approximately 0.65 cc's per side. And this gives us a nice full hand without overdoing it. If we're going to have Michelle come back in about a week, and we're going to take another look, and if some more needs to be injected, we're going to do that. But in the meantime, we're also going to recommend some skin care for Michelle's hands. And the things that we do at Renew are FACS laser, in combination with chemical peels, and we would also recommend a retin A treatment at home of some sort. And we have a vast array of products here to treat that, so that the skin can become as youthful looking as the hands do now. So that's probably it for now.